Cryne from Eura, and it's a pleasure to welcome you back to our series of interviews with Eura's friends and family and members across the globe during this extraordinary time that we are all living through. I'm delighted to introduce you to Steve Cryne, the CEO and President of the Canadian Employee Relocation Council. Steve and I chatted on Tuesday the 24th of March. Just so that you're aware, things are changing obviously on a daily basis, so pretty well as soon as we've conducted these interviews, they could well be out of date. We will be repeating them all over the coming weeks, but let me just introduce you to Steve.
And welcome back to this series of interviews with Eura's members and friends across the world. I am delighted to be talking with Steve Cryne, who is our esteemed colleague at the Canadian Employee Relocation Council. Many of you who have been to the conferences will have heard Steve speak very eloquently over the years about issues within mobility and the talent management community. So Steve, it's a real pleasure to talk to you. Thank you. It's always great to catch up.
Pleasure.
Tell me first of all, what's happening in Canada at the moment? We're talking about, just in case this goes out later in the week, today is Tuesday, March the 24th, because everything's changing every day.
Yeah, well, that's that. I'm glad that you qualified that, because what I say today will definitely change within the next day, I'm sure, and possibly even within the next hour. We've been dealing with the coronavirus as the rest of the world has, and I think that we've been under isolation and store closings, etc. For the last 10 days. The schools closed on March the 13th. That was a part of the March break closure, but they've extended that break until at least, I'm looking at my calendar, April the 6th, so just after the Easter break. But in a few of the provinces, they're already making announcements or suggestions that they'll probably close the schools until September, which is a very significant move as they're trying to control the spread of the virus, and of course the implications of that on families is very, very difficult in terms of arranging daycare, because all of the daycare centers are closed. Most of the cities have closed all of their bars, all of their restaurants, museums, leisure centers, hockey rinks, swimming pools, art galleries. The government is trying to reduce the interaction between people. This whole, I don't think there was a phrase social distancing until we got into this.
Yeah.
So, I live right in the city of Toronto, and our office is downtown. I live downtown. Everything is closed. You cannot get a cup of coffee anymore. I know of one place, but I'm not going to
tell anybody. Right. That must feel utterly surreal.
Well, it is. I live right across from one of the big telecommunications companies here, one of the largest insurance companies in Canada, if not North America. And their offices are completely closed. There is nobody on the streets. It's like 2 a.m. on a Sunday morning. So that's where we are. But it's moving so quickly. Our Prime Minister is doing daily briefings. They are trying to. I think there's certain areas where people are not practicing this idea, this social distancing.
Right.
So the government is getting quite stern in their wording, indicating that if you do not do this on a voluntary basis, then we will impose more limits. I feel, and I think, I speak for probably all of us that are going through this, regardless of where we live or work, is that we have a tremendous amount of respect for the people that are keeping the essential services going, our physicians and nurses and healthcare workers. Even the people in our grocery stores have been deemed an essential service.
Yes.
We certainly respect their efforts in this. It's a sad time.
I mean, it's really interesting that you say that, because I mean, here there's been a lot of people drafted back into our health service, who've retired, voluntarily drafted back. But again, it was that the only stores that remain open are the grocery stores, and I'm sure it's the same for you. And those people are essential workers, and it's just so surreal. In the last weeks and months, what has been the response from the mobility community in Canada?
Well, we're still trying to catch that up. I think everybody is, frankly, I think, stunned that we're suddenly in this place, where all of the planning that we were doing for moving a family from A to B, that's all been shelved right now. And the urgency is to, make sure that people that are outside of the country are in a safe place, or they have a repatriation back into the country. We have done some surveys to try to measure what companies are doing. Certainly within the countries that, I think there were 7 countries that we included in the survey in the last couple of weeks, and that was obviously, China. But in the first survey, we did 2 surveys. Let me back that up. We did 2 surveys. In the first survey, we only included Hong Kong, Singapore, China, and Japan. And then we extended that to include Italy, Spain, etc.
Yeah.
And most of the companies that have people in those areas, they had not yet evacuated people, but whether that changes, we don't, we'll see. But most of them were providing support so that they could work from home or from other locations outside of the affected area. And that comes with some complications as well around the timing of work permits. There are tax issues that have to be considered. The companies that I think the companies that put in place or have programs around tracking their employees for duty of care have probably got a pretty good handle on where their folks are, and they perhaps thought these things through, not necessarily as it relates to the coronavirus, but what are the scenarios? What happens if these things emerge? How do we get our folks back? So those are most of the questions that we've been fielding. Is trying to get information back out to people. We've just recently put on our website a coronavirus information and resources page.
Excellent. Yeah, we just
so that if people want to try and get updates from the public health units, and we'll be growing that information out. So back to your question, I think people are going, gee, we've not been here before. And they're having to come up with some creative solutions to get people back home. Canada is not allowing any international flights in, or very few.
Oh, right, okay.
I think there were some flights coming in from Morocco on Sunday and Monday. The status of that today, I'm not sure.
I mean, it is. You're right. It is just surreal. I mean, from again the point of view, I was just talking to one of our members in Athens for one of these interviews, and she was saying, from their point of view as a supplier, as a DSP, they're actually super busy because they need to keep the information flow out to their assignees, the people they've been working with over the last couple of years, because they know, not just because they're in a different country, you're not at home, which increases the stress of that for the families that are involved and
right.
children no longer being at school, but also because being in Greece, they can't necessarily even read the press releases that are being given out from the Prime Minister's office. So, there's just every which way you look at this, we are still, kind of caught in the headlights of this crisis at the moment. And, it's going to take time. So, I mean, I've said this to everybody, but if you wouldn't mind, if we can circle back in a couple of weeks and update where we are then, that would be awesome.
Yeah, no, absolutely. Great. We I think I mentioned, last week we did a webinar that provided, some guidelines around and information around what people needed to be considering when it came to immigration and tax. But that also included some very good information about how you deal with your employees right now and how you support them. And that's vitally critical because, we know this is going to pass, and there will be, I won't say that things will return to normal necessarily because we don't know.
No.
But there will be a new normal, and companies are going to need those resources, those very talented people, in order to help them rebuild their businesses. And so I think that's a point that that companies need to keep in mind, top of mind, actually.
I mean, I think, again, from your point of view within the CERC, as an organisation, you're incredibly well prepared for that. Your dialogue with the mobility community is so strong. And it was interesting yesterday, I was talking to Alistair Murray, based in the UK, and he was telling me that, a group of their direct competitors, they're all direct competitors working across London and the Southeast, have actually got together in order to form a completely unofficial, but just to contact their MPs, talk to, various people in chambers of commerce, to make them aware. Look, you're all obviously, concerned about the hospitality industry and the airlines, but realise the importance of this niche industry in the rebuild that's going to have to come after this crisis.
Yeah, that's a great strategy. It really is.
I was very impressed. Yeah,
because nobody really understands this
that's
industry.
Very true. And what it's going to mean for talent mobility and for regrowth, and it's going to be
absolutely.
It's going to be,
and we're going to need that
people
going forward.
Absolutely,
whether it's in healthcare.
Absolutely, yeah. I mean, you're so right. How have you coped? So you're all working from home as an organisation. How did that go? How is your team coping?
Well, this is a challenging time. That we only have three staff.
Yeah, very much.
And just before we got the lockdown, so to speak, one of my staff members, my admin assistant, she gave me her resignation. I think on March the 3rd or 4th.
Right. Oh no.
And it's always a challenge. We're a small organization, and she had an opportunity to move up to a better position, if you will, with some more management requirements. And so at the time it was, okay, well, we'll deal with this and take it under our wing. But now we've been scrambling because our office has been closed since the 9th.
Wow.
The 9th of March, essentially.
That was very
Yeah.
early. Yeah.
And so we've been struggling a little bit, frankly, to maintain the support and so on. But we're getting those things. We've got those things in place now. So there's just two of us, and I have some part-time support from somebody. So, it's like anything else. You just dive right in and figure out how you're going to do these things.
You do.
Our most important initiative or need at this time is to make sure that we stay connected with the members and helping to support them through this time, because companies are having to adjust their policies and their programs to adapt to this new reality. So we're figuring out ways in which we can connect people more effectively so that they can share information.
I think it's the only thing. I mean, it's the only thing, but not the only thing, but it's the pivotal thing that we can do as organisations representing members. I mean, that we feel the same way. Just opening up those avenues of communication and I mean, from my point of view personally, I know we were saying this before the call. It's communicating that actually normalizes this extraordinary situation, that we're all going through the same thing at the same time, which is just extraordinary. In terms of I was going to ask you briefly about the closure of the border between the US and Canada for cross-border trade, and I know you've been very involved in the organisation that deals with cross-border trade, and how is that impacting?
Well, they closed the border on Friday at midnight, last Friday, the 20th of March. They didn't close it. They closed it for non-essential travel.
Okay.
So tourism, shopping, you want to go visit your children, you can't do it.
Right.
And
you have family living in the US, right, on the West Coast? You have family living in the US on the West Coast, right? Yeah.
I have family. I have a family in Washington D.C.
Right.
and family in Seattle.
Yeah.
Yes, that's so. In terms of the border closure, it's to all non-essential travel. Goods and services are still in play. So there's over $2.5 billion.
That was
of trade.
Wow.
Goes back and forth on that border every single day. That will dwindle, I think, as a consequence of not as a consequence of the border closure, but a number of our auto plants are closing in both countries. So we have a very integrated supply chain.
Yeah.
So there'll be certainly less traffic going back and forth. We have a lot of healthcare workers that work in the border cities. So say, between, I'll use here in Ontario, Windsor and Detroit.
Mm-hmm.
There's a lot of healthcare workers that work in both countries, and they commute back and forth. So it's very important that they keep, and they have done, they've kept that open. I think we're still getting clarity on this at the time in terms of what essential workers are. But from all indications, if you have a work permit and a valid visa, you would still be able to cross the border.
Okay.
To work in either US or Canada.
The other way around. Okay. Oh, interesting. Has the Canadian government yet started the dialogues with the business community about subsidies, tax cuts, support? Has that
most definitely. Okay. Yes, they have. The numbers are staggering.
Yes, aren't they?
I think I think there was a package released late last week. It was for, I think, $82 billion. There is another bailout of $60 billion coming. Now that's not to industry necessarily. That's total packages in terms of maintaining the financial viability of maintaining the viability of the financial infrastructure. Yeah. There's money going into employment insurance to reduce waiting times. There's talk of completely relaxing the eligibility requirements for employment insurance because so many companies have closed and they're laying off their staff. Everybody from the people that serve you a coffee in the morning and work in the restaurants, clean the hotels, work in the hospitality industry, work in the stores. All of the stores here are closed. It's quite. We use this word surreal, but you just can't fathom it. And then you think about, well, what are these companies going to do with all their inventory? If we don't get this resolved soon.
And this is where
it just plays on.
Yeah, it really does. I mean, we're talking about abstracts, but in a way, this is the kind of situation that actually needs a world government. It needs coordinated structures at the very highest levels, and we'll see whether that happens. Just before we finish, I'm fascinated by the fact that Canada has, arguably the greatest health service in the world, and it's 100% government funded, right? The NHS in Canada it's not called the NHS. What do you actually call your healthcare system?
Well, it's not a national health service. No, it's the health insurance or the health services, the healthcare system is, and this is my terminology. Sure, is a patchwork of systems within each province.
Right.
Each province has authority over their healthcare systems. They do coordinate. And there is a federal Ministry of Health that provides support and directives to the provinces. But no, we do not have a national health service. It is a universal program. Yeah. In that everybody has access to it generally without a fee. Mm-hmm. It's built into the tax base. So we pay higher taxes, but we have access to fairly good quality healthcare. Yeah. And for the most part, services such as getting the COVID test and so on, diagnostic testing, etc., emergency care, all of those are covered through the system
and universally accessible. Yeah.
Yeah, I did see something yesterday where I believe it's Ontario. So one of the challenges for people coming back into Canada is that if they're repatriating, there's a 3-month waiting period before they can be eligible.
Oh, okay.
And I think that the provinces, or one province so far, to the best of my knowledge, has relaxed that requirement.
Okay, well, good, because I mean, if they didn't relax that requirement, can people access private healthcare services?
Yes, they can, but the private healthcare services are also taxed. Maxed out at the moment.
Sure. Yeah. So you would be left high and dry if you. Yeah.
Yeah, the private healthcare services, they're actually donating their services.
Same in the UK.
So, ventilators, masks, gowns, etc. They're in such critical shortage here, which I think is the world over.
It is indeed. I mean, Steve, thank you so much. It's always great to catch up with you, and thank you for your insights. Like I said before, I'd love to circle back in a couple of weeks' time, see where we were then, and hopefully we will know more. I mean, but in the meantime, I wish you and all the members of CERC the very, very best.
All right.
And great to catch up with you.
Next time when we chat, hopefully we're into that new normal stage.
It would do my nerves an enormous amount of good if we were, I've got to tell you.
All right.
Steve, great to
catch up.
Well,
all the best to you and to you over there.
Thank you very much indeed. Great to catch up.
Cheers
Steve. Bye-bye.
Yeah, bye-bye.